Nutritional disorders. Classification of nutritional disorders. First is undernutrition, overnutrition, specific deficiency and imbalance. Undernutrition, marasmus. Overnutrition, obesity and hypervitaminosis. Specific deficiency, kwashiorkor, hypovitaminosis and mineral deficiency. Imbalances, electrolyte imbalance. Moving on to etiology. Primary causes are low income and low purchasing power, scarcity of food supply, overpopulation, ignorance and wrong food habits. Secondary causes are infectious diseases, metabolic disease, hepatobiliary disorders, intestinal malabsorption and diarrhea. Classification of undernutrition. First is Gomez classification. Uses weight for age measurements, provide grading as to prognosis. It uses weight for age measurements. Mostly two measurements are considered. One is weight for age, another is weight for height. But here weight for age is used. If weight for age is considered is in the category of 91 to 100, then its status is normal. 76 to 90 first degree, 61 to 75 second degree and less than 60 is third degree. Second is Waterloo classification. It is adopted by WHO and can distinguish between deficits of weight for height, percent wasting and height for age stunting. Height for age and weight for height. Greater than 95 normal, mild 90 to 95, moderate 80 to 90 and less than 80 severe. Considering weight for height criteria, greater than 90 is normal, 80 to 89 mild, 70 to 79 moderate and less than 70 severe. Third is Wellcome classification. Simple since it is based on two criteria: weight loss in terms of weight for age and presence or absence of edema. If weight for age percent is in the category of 80 to 60 and edema is present, then it is kwashiorkor, and edema is absent, undernutrition. Less than 60, it could either be marasmic kwashiorkor, or if edema is absent, then marasmus. Nutritional problems. Nutritional problems include low birth weight or LBW, protein energy malnutrition, which is also called as PEM, xerophthalmia, nutritional anemia, iodine deficiency disorder or IDD, endemic fluorosis and letharism. First is low birth weight. It is a major public health problem in India. 28% babies born in India are LBW and are less than 2500 gram weight. Causative factors are maternal malnutrition and anemia, illness and infections during pregnancy, close birth intervals. Factors modifying prevalence of LBW: more institutional deliveries, improving number of ANCs or antenatal care visits, minimum greater than 5. Improving quality of ANC or antenatal care includes number of ANCs, TT, weight, BP, examination of blood, examination of urine, etc. Moving on to protein energy malnutrition. Now PEM is broadly considered of two types. First includes marasmus and second is kwashiorkor. Marasmus, it is common in the first year of life. Etiology: balanced starvation, insufficient breast milk, dilute milk mixture or lack of hygiene. Clinical manifestations include muscle wasting, growth retardation, mental changes, absence of edema. This is important point. Absence of edema, and variable subnormal temperatures, low pulse rate, good appetite, diarrhea. Laboratory findings include K plus deficiency is present, serum cholesterol is low, diminished enzyme activity, and bone growth delayed. Liver biopsy will either be normal or atrophic. Kwashiorkor between 1 to 3 years old. Etiology is very low protein but weight in places where starchy foods are main staple, never inclusively dietary. Clinical manifestations include diagnostic signs, edema, and muscle wasting. Now, here in Kwashiorkor, edema is present, in marasmus, edema is absent. Common signs include hair changes, diffuse depigmentation of skin, and moon face anemia. Occasional signs include flaky paint rash and hepatomegaly. Laboratory findings include decreased serum albumin, EEG abnormalities, iron and folic acid deficiency, liver biopsy, fatty or fibrosis may occur. Moving on to preventive measures. First is health promotion. Educating and distribution of supplements pregnant to lactating mother. Promotion of breastfeeding, low cost weaning methods, improve the familial diet pattern, correct feeding practices, and family planning and spacing of birth. Second is specific protection. Protein and energy rich food for child, milk, eggs, fruits, etc. Immunization and food fortification. Fortification is the process via which the nutritional quality of the food is improved. Um, Food is made rich in vitamins and minerals. Early diagnosis, period surveillance, early diagnosis of lag in growth, rehydration of children with diarrhea, supplement feeding, deworming of infested child. Fourth is rehabilitation, nutritional and rehabilitation services, hospital treatment, and follow up care. Third is xerophthalmia or dry eye. It is disease in which often there is absence of tears. It is caused due to deficiency of vitamin A, also called xeroma, absence of tears. Xerophthalmia is most common in children aged 1 to 3 years. Cornea and conjunctiva become necrosed. Fourth is iron deficiency disorder. IDD refers to a spectrum of disabling conditions arising from inadequate dietary intake of iodine. IDD affects the health of humans from fetal stage to adulthood. Etiological factors: deficient iodine intake, consuming foods with low iodine content, crops growing in iodine depleted soil, increased demand for iodine in the body. Demand for iodine is increased during the period of rapid growth. What are the periods of rapid growth? They are infancy, puberty, pregnancy, and lactation. Demand exceeds the supply, which causes iodine deficiency. Presence of goitrogens or goiter producing substances naturally present in some foods. Cabbage, cauliflower, etc. interfere with iodine utilization. Iodine deficiency disorders are endemic goiter, in which there is enlargement of thyroid gland causing swelling in front part of the neck due to lack of iodine in the diet. Goiter belt, Himalayan region, more common among girls than boys. Second is cretinism. It is a severe form of IDD, occurs in fetal stage, interfere with brain development, causing brain damage and death. It results in growth failure, mental retardation, speech and hearing defects. Fifth is letharism. It contains a toxin called beta oxaloaminoalanine. Lathyrus or kesari dal is a good source of protein and it is relatively cheaper. Now, what are the steps for intervention? First is removal of toxin. Steeping method. Soaking the pulse in hot water for about 2 hours and the soak water is drained off completely. Genetic approach, development of low toxin varieties of lathyrus, or banning the crop. Prevention of Food Adulteration Act in India has banned lathyrus in all forms. Sixth is nutritional anemia. It is a condition in which the hemoglobin content of blood lower than normal as a result of a deficiency of one or more essential nutrients, primarily due to the lack of absorbable iron in the diet. Etiological factors: inadequate intake of iron, poor bioavailability. Bioavailability means less than 5% is absorbed. You may be eating you may be eating sorry you may be eating iron rich food, but a lesser part of it is absorbed by the body. That is called poor bioavailability. Excess loss of iron in form of menstruation, rapid pregnancies, hookworm infestations and other illnesses. Effects of anemia: increases the risk of maternal and fetal mortality and morbidity, increase the susceptibility to infection due to impaired cellular response and immune functions, reduction of work performance and productivity. Intervening Intervening steps include iron and folic acid supplementation, nutritional anemia prophylaxis program, under which daily iron and folic acid supplementation to pregnant women, lactating mothers, and children under 12 years are given. Iron fortification of salt with iron, control of parasite and nutrition education. Seventh is endemic fluorosis. See, fluorosis is a disease which is caused by deposition of fluorides in hard and soft tissues of the body, and it is usually characterized by its primary feature is discoloration of teeth and crippling disorders. Rajasthan and Gujarat in North India and Andhra in South are worst affected. Punjab, Haryana, MP and Maharashtra are moderately affected. Tamil Nadu, West Bengal, Uttar Pradesh, Bihar, Assam are mildly affected. Throughout India, fluorosis is essentially hydrofluorosis except in parts of Gujarat and UP where industrial fluorosis is also seen. Epidemiological triad. Epidemiological triad, it contains three elements: agent, host and environment. It essentially explains how disease is caused and transmitted. First is agent factors, primarily by the fluoride which is present in drinking water. When fluoride exceeds more than 1.5 mg per liter, it is toxic to health. pH in terms of alkalinity of water promotes the absorption of fluoride. Calcium in the diet reduces the absorption of fluoride. Hard water rich in calcium reduces the fluoride toxicity. Fresh waters and fresh fruits and vitamin C reduces the effect of fluoride. Host factors: school going children seen in the third and fourth decade of life, seen as skeletal. Fluorosis: males suffer more than females. Where aluminium ores are mined, it is seen as occupational health hazard. Environmental factors: high annual mean temperature, low rainfall, low humidity, fluoride rich natural rocks, vegetables from high fluoride belts, fluoridated toothpaste, particularly when used by children, tropical climate, and developing countries. Clinical manifestation of features: dental fluorosis in children. White teeth become dull and yellow. White spots appear on the surface of teeth. Gradually, these spots turn brown. Skeletal fluorosis in adults, or which is called crippling fluorosis. Lifetime daily intake of 3 to 6 mg, one or more, leads to deposition of fluoride in skeletal bones. Now there are three kinds of tests for skeletal fluorosis: point test, chin test and stretch test. Prevention of fluorosis: defluorination is best preventive measure. Intake of vitamin C and calcium. Now this is not important. Defluorination: lime treatment, use of alum and Nalgonda technique, in which it is based on the amount of fluoride in drinking water and alkalinity of the water. Amount of alum to be mixed with water is calculated. Resins and other filter beds are also available, filtering through which reduces the amount of fluoride in water, and this is the exact setup of that process.